Hi, this is Erin. I'm just going to be running through my population PowerPoint, and the population that I was focusing on was the single parent or single parent of multiple children, and the health concerns associated. So, um, the traditional family is kind of a, I mean, can be interpreted different ways these days, but generally mother, father, children. Um, Not often the case. More parents are finding themselves, dads and moms, raising their children on their own or, you know, with help from, grandparents or things of that nature. So, it's just a little bit different than just having, both parents of the children all in one home. So, here in Utah, in Davis County, where I live, the statistics I found were that about 5% of households are single mother households. And honestly, I had a hard time finding just single parent or single father statistics. A lot of it was just single female or single mother. So, which I thought was kind of interesting because it's definitely not just mothers who are single. But here we are. This is what was on the Department of Health website. So there's a map here just kind of showing the counties in the state and where there are more single mothers than not. So obviously San Juan County down in the bottom there's a lot of single parent households. Davis County, like I said, is 5%. The state as a whole is 5.2%, and the country is 6.8%. So less than 10% are single mothers, mother households, but still a decent percentage. Then this little chart at the bottom just kind of breaks it down, just kind of the different family structures compared from Utah to the country. So this one's just talking about the social determinants of health and how that affects, a person and obviously their health care, education is a big thing. And I think the biggest factor, honestly, is money. Because if you have money, you can, maybe live in a nicer area, you can afford health care and, afford the things that you need. So, single parents, every situation is different, and also depending on how long that you've been a single parent, that can kind of determine where you're at. I know personally I am a single parent, and I know, when I was first a single parent 4 years ago, I was much worse off than I am today. So it just kind of depends on, where you're at also in your life. So you can be affected by many things or not really anything. It just totally depends on, your economic situation and also the support that you have. Support from other family or, just the community is invaluable. But single parents definitely can be more susceptible to certain health risks. So here's just a little rundown of kind of what I just said, but low or unstable income, a big factor, possibly unsafe living situation. Single parents may have a hard time finding, a home they can afford that's in a good area or with, people that they trust. Access to help with children and childcare is a huge thing. When you don't have both parents in a home, it's much harder to do certain things that you may need to do for yourself, like go to the doctor or the dentist or do things that you need to do for yourself. And so lots of parents probably just choose to opt out of doing those things. Then the last one I found when I was doing research on this, I think the overwhelming thing that most single parents struggle with is their mental health and also poor sleep. So just depending on whether, they're working one or two or more jobs, or, whether they have their kids all the time and the ages of the kids. I think that's the thing that probably most single parents really struggle with, is their mental health. So a root cause why a single parent is a kind of vulnerable population, I think really is just that there's some bias and judgment against single parents, and maybe why someone is a single parent, or, some people who, maybe have good marriages or never experienced that themselves, just don't really understand why, why that person would be in that situation. They may judge them, and I think that's kind of a common thing. And so sometimes society isn't, and the community, doesn't necessarily have things that could help a single parent, good resources, or maybe just people just don't really know even how to help someone who is a single parent. So maybe starting that conversation would be something that would be helpful. But as far as the Maslow's pyramid, honestly, this is one that's just, it just depends on the situation. It's just, and a lot of it is economic also. You may have, trouble with the bottom of the pyramid, just simply affording good food for yourself and your children and having a good place to live. Whereas some people, who have child support or have good jobs, they do, can work up the pyramid. So I would say, there are some people who probably struggle with just the bottom of the pyramid, and some people who are doing just fine, and, who like being single and don't really see a need to change their relationship status necessarily to get, the intimacy or, other things, the respect and other things on the pyramid. So I think it just totally depends. As far as like diseases, I don't think there's one specific disease that a single parent of multiple children would have or be at risk for getting, but it just kind of goes back to if they maybe are struggling with a disease, or if they have diabetes or some sort of pre-existing thing, maybe they aren't going to be taking care of, themselves the way they should, just simply because they either can't afford to go to the doctor, or can't find time to, or can't find that support, or don't have money to buy insulin, or just any number of things. So, yeah, it just depends on the situation. There's no specific infection or anything, though. I think the biggest thing, obviously, is this slide. As I said, the self-care. Generally, a good parent is always going to put the needs of their children above their own. So that's the biggest thing. So whether it's intentional or not, you just, I find myself, I just get in the zone and I take care of my kids, and I don't even think about myself or taking, I make appointments for my kids to go to the doctor or the dentist, or, do extracurricular activities or things. Like I do that for my kids, but then it's just like I hardly ever do that type of stuff for myself. So it's just kind of a matter of even parents just kind of looking inward instead of just caring about their kids, and also just recognizing that, they matter too. So single parents, they're going to struggle with the psychological and also possibly like social judgment, and maybe feel self-conscious in that way, and then also the sleep issues. So, and here's a couple of my references that I used, and yeah, thanks.